The most important thing to understand about what we do is when we treat periodontal disease, we're treating a chronic inflammatory disease. Yes, it's present in your mouth, but the ramifications can affect the rest of your body.
In 2010, there was a study that showed that upwards of 50% of adults in the United States suffer from either mild, moderate, or advanced periodontal disease.
Inflammation does not stay in one site. A lot of these inflammatory mediators that the bacteria of periodontal disease cause, they travel to remote areas in your body and they can cause issues. One of the more researched issues and a very hot topic nowadays is actually the effects of periodontal disease on your susceptibility of developing heart disease, namely heart attacks and strokes.
It may be that you have symptoms that you could notice though, like bleeding gums, drifting teeth, your bite is off, bad breath. These are some of the symptoms that you might notice, but it really takes a trained dentist to do the proper clinical exam, checking the pocket depths around the teeth and taking the proper x-rays or radiographs to make the diagnosis.
So these are just small examples of how people need to realize that you don't have a mouth problem or a gum problem. You have a systemic problem. In this office, we don't just treat the mouth, we treat the person. And it's very important that people understand that at the end of the day, health issues in your mouth can cause systemic health issues elsewhere.